Welcome to this edition of Champion Chat. I'm Frances Reid, Programme Director for the World Ovarian Cancer Coalition. In this edition, I'm delighted to talk to two people who've spent a number of years working to try and support doctors, family doctors, to improve the diagnosis of women with ovarian cancer. Their projects relate to Target Ovarian Cancer, one of our charter champions, for their work on supporting primary care. In the United Kingdom, we have a known issue through our own study, the Every Woman study, but also the International Cancer Benchmarking Partnership and other work, to have a particular problem with being slow in diagnosing women who may be ill. So I'd like to introduce you to Dr. Sharon Tate, Head of Primary Care Development for Target Ovarian Cancer, and Dr. Alison Wint, a recently retired GP and clinical lead for cancer and specialised commissioning services for NHS Bristol, North Somerset and South Gloucestershire Clinical Commissioning Group. And she's a member of the Target Ovarian Cancer GP Advisory Board. Welcome both, you're very welcome indeed. Sharon, Target Ovarian Cancer has a toolkit of resources and activities aimed at supporting primary care professionals. Can you give us an overview of what is included?
Yes, certainly. So supporting education and improving knowledge is the cornerstone of our work. And the GP Toolkit is a suite of resources that supports GPs in their day-to-day practice. The most important element of that particular toolkit is our online e-learning modules that we have developed in association with BMJ Learning and RCGP e-learning. And these are a robust approach and a well-recognised learning tool for primary care professionals that they can work through to update their knowledge of a particular subject, in this case ovarian cancer. Other core components of the GP Toolkit include our 10 Top Tips resource, which is basically one side of A4 with the most salient points about ovarian cancer. So we always say, if you know nothing else, just please refer to the 10 top tips. These are the absolute fundamentals, the nuggets information that you really need to know. Other resources include fact sheets. So for example, we have one on CA125 blood test and also on family history. And we also have, for example, a symptoms diary that GPs can give to their patients to help them monitor and track their symptoms. But I think it's fair to say by far our absolutely most popular item is our flag pen. And if anyone is unfamiliar with a flag pen, it's simply this, a pen that pulls out information. And as you can see here, this here is a pathway taken from the national guidelines for ovarian cancer. So it's a really quick and easy way for a GP to quickly refer to national guidance. And then on the other side, we've included symptoms information and just a bit of information about the charity. Regardless of the focus of the particular resource, we always take the opportunity to include symptoms information. It's absolutely fundamental. If GPs aren't aware of the symptoms of ovarian cancer, how can we expect them to consider it as part of their differential diagnosis?
So what have been the key factors in developing these resources? What's really helped you?
Well, I think in terms of developing the toolkits and the key factors that underpin that, we want the toolkit to be evidence-based and also to cater specifically for the needs of our audience, which are primary care professionals. There are a number of factors that we consider when developing new resources. So, for example, we will gain feedback and guidance from the end user, so the GP or the practice nurse, whoever the resource may be targeted as. And we may gather this through a series of avenues, including our own Target Ovarian Cancer Pathfinder study, or through face-to-face engagement when we go to health professional conferences, or even through feedback and guidance from our GP Advisory Board. It's also really important that we include health professionals in the development and the review of the resources, because it has to have the right tone and use the right type of language. And also, where possible, we try to use the voice of the healthcare professional and using individuals who are really passionate about improving ovarian cancer diagnosis and outcomes for women.
And Alison, you are one of those people, I think, aren't you, really? But as a GP, ovarian cancer is definitely one of those diseases that's hard to diagnose because the symptoms are just not specific to ovarian cancer and really common in the general population. But do you think it's getting easier now for GPs to diagnose?
Well, I think you've hit the nail on the head that the individual symptoms of ovarian cancer could be caused by a variety of different things. And there's an old adage, you know, that if you hear galloping hooves, you think horses, you don't think zebras. There are the zebras. And in my own career of 30 years, I've only been involved in the diagnosis of ovarian cancer a handful of times. So it's not common for an everyday working GP to make the diagnosis of ovarian cancer. But when simple remedies don't work, when symptoms persist or develop or change, then the penny drops. And I think it's fair to say that the cases I've been involved in have been older women, but then we do know that younger women can get ovarian cancer as well. So that's where the work of targeted ovarian cancer really comes into you know, helping GPs identify those younger women who may have this sort of collection of symptoms that can't be put down to something simple, and we do need to investigate and make sure that we get the diagnosis right. So in fact, having access to the blood test CA125 is something that wasn't universally available to GPs across the UK. It was a secondary care only test for a long time, and that hindered primary care clinicians in having access to it and being able to make that diagnosis. And also sometimes doing the ultrasound tests could be a very long wait for that. So there are various factors within the system that can slow down the diagnosis, as well as GPs having their antennae tuned to that as a possible diagnosis.
Alison, for you, what has been key in terms of the approach that Target Ovarian Cancer has taken to helping GPs diagnose ovarian cancer? And do you hope things will continue to improve?
I think Target Ovarian Cancer have a fantastic media team that really raise the profile of ovarian cancer. It's not one of the big four that often gets a lot of the headlines, you know, breast and prostate and bowel cancer and lung cancer get all the sort of major headlines and the major focus when it comes to system reporting and things like that. But Target Ovarian Cancer has really waved the flag for ovarian cancer and invested in primary care education, raising the awareness in women. I mean, Sharon's touched on the personal app that women can have. There's been various advertising campaigns. I mean, that's how I got in contact with ovarian cancer in the first place. But I am passionate about improving the outcome for women. It's a devastating diagnosis for women, whatever their age, and whatever we can do to speed up the diagnosis so that they don't end up in emergency and that they have access to treatment that has a possible curative effect. That's my reason for doing it, and definitely would want to see their work continue.
Thank you. Sharon, can I turn to you? Do you regard the work that you have done to date as successful? And what would be your tips to other groups who might want to start work in this area?
Overall, I do believe that the work that we have been doing has had a positive impact on health professional knowledge and confidence to refer, and brought about improvements in terms of, Alison mentioned earlier, access to CA125 previously wasn't universal, and that really changed when we were able to demonstrate this through our Target Ovarian Cancer Pathfinder study. So as an organisation, we've certainly been able to influence support for diagnostic tests. We see from Pathfinder study again that GP knowledge is improving, and from national data we know that there has been a reduction in the number of emergency presentations. However, there is still a long way to go and a huge amount of work to do. We've talked about diagnosis early stage being variable, and we also really need to reduce short-term mortality, and we're striving for the best experience for both patients and healthcare professionals, because nobody wants to be that person that misses the ovarian cancer diagnosis. In terms of advice, there are really 3 pillars that underpin early diagnosis as far as I'm concerned, and that is public awareness of symptoms and the confidence to go to the GP and report those. We have to have GP recognition of symptoms once the patient comes into practice, and also, again, knowledge of how to best use their local systems to expedite diagnosis. And the final thing is the systems in place to support the GP. It's great having a really knowledgeable and proactive GP, but useless if they don't have a test that they can use. So my top tips for early diagnosis or improving early diagnosis are make evidence the foundation of everything that you do. Know your target audience and understand the challenges, their needs, and tailor your evidence to support that need. And also work in partnership with external organisations for their expertise, and also your colleagues in policy and public affairs. That is how we've driven a lot of improvement in early diagnosis. I really think that the only way to get it done is through partnership, and offering support is a critical friend.
Thank you both very much, and I wish you all the very best in your future work. Thank you.
Thank you.